Okay, can somebody give me a thumbs up if you can see the slides? Okay, and we're recording. So you're gonna get 5 minutes to talk. There'll be a 2-minute warning. And so if we interrupt you, we apologize for that. It's just to stay on time because we do have a lot of programs in this one. So first up will be University of Tennessee. We'll get you a timer going and you can go ahead and start once I put your slides up.
All right. Hi, everyone. I'm Meghna. I am one of the pediatric chief residents at UTHSC, and I'm on with a lot of Dr. Dobish and Dr. Pishko, as well as Dr. Young and Corinne, who's going to be talking alongside me. So we'll just go ahead and get started. Our residency is about 24 residents per class with 2 child neuro residents, 12 mid-peds as well. We are a large 12-story freestanding tertiary care children's hospital with about 255 beds, a level 1 trauma service, and a level 4 NICU. We have almost all subspecialties available, and we're undergoing further expansion with our cardiology unit as well. Total hospital admissions and about 85 to 90,000 total ED visits. That was 2019 because 2020 numbers are skewed, obviously. In addition to having such an awesome freestanding hospital, we have a partnership with St. Jude's Research Hospital, which offers world-renowned hem-onc care and leads pediatric oncology research efforts, and residents will spend two months there at least as a second year, and you can do more with electives. Things that make our program awesome: we have diverse patients with great pathology, both bread and butter and rare. And in addition to St. Jude, our hospital at Baton Children's is equipped with subspecialty trained nurses that provide excellent care on the floor. So as residents, we get to take care of patients in DKA on the floor. You get to take care of patients with bronchiolitis who have to be on high flow on the floor, and you have options to get to do many, many procedures. Our residents go on to do great fellowships. So some examples are Baylor, Texas Children's, UT Southwest, Colorado, Cincinnati, nationwide. And they feel well prepared for whatever challenges that they will face. Our graduating class at about 70% go into subspecialties and 30% go into primary care, but those numbers are changing. For example, our class of 2023 has about 50-50. And as noted in the infographic, we have many avenues for opportunities and advocacy. So we have a medical legal partnership with UTHSC formed to help our patients and families with regards to income, insurance, and legal status, and there's also global health tracks. We have a dedicated program for wellness with scheduled morning reports for inpatient teams, counseling resources that are readily available, yearly retreats, and resident appreciation weeks. And those are just the scheduled things. Our residents do a lot of things outside the program as well. And then as mentioned on the right, we have lots of ongoing diversity initiatives. So we have a Pediatric Diversity and Inclusion Committee, and it's growing all the time. We have focused efforts on recruiting underrepresented minorities in medicine. We just rolled out an anonymous microaggression and bias reporting system. We have quarterly health equity rounds and diversity discussion panels, ongoing mentorship program, and opportunities for get-togethers and fellowship outside of work as well. And I'm going to pass it on to my co-resident, Corinne.
Hey guys, I get to talk about a few of my favorite things for UTHSC, one of which is the fantastic autonomy we have. We have a really good blend of wonderful attending to reach while still having our own patients. Overnight, there's no attendings in-house, and so they are your patients. You are the one making the decisions. The attendings are always available to be reached by phone. They give you their phone number, but at the end of the day, they trust you to make those decisions. Another really awesome opportunity for us is when you're an upper level, you're actually the one holding the transfer and admitting phone. So you get to make those calls of, are they safe for the floor? Are they more likely to go to the PICU? And really get the opportunity to see what's like kind of at the top of the chain in a hospital. Another great thing about UT is the schedule in general. So we alternate inpatient, outpatient months, and then you only go to clinic on those outpatient months. So you never have the awkward trying to prepare for rounds and then running to clinic. When you're on the inpatient side, you are focused on the inpatient side, which is really nice. As well as that, in our continuity clinic in general, you get to have the option of doing our resident clinic, or working in the community clinic. So if you are aware that I want to go into primary care, you can just from the get-go be working in one of the community clinics, which is really nice. And as a third year, you can choose to do one of the subspecialty clinics. So if you're going for a fellowship, you can be in the cards clinic if you're going to be a cards fellow. Another really nice thing about our program is that we do focus on wellness. We get a lot of nice free perks for being residents at UT, one of which is so much badge money. We get free food every day at noon conference as well, and you don't pay for parking. The parking in general is a very safe, gated area, which as a woman, I really appreciated when looking at UT. Another really, really great thing is just the people in Memphis in general. My co-residents are my best friends. There is something definitely to be said about Southern hospitality, and the people in our residency. We hang out outside of work all the time. So it's really good to be surrounded by people that really care about what they do and really care about you. Memphis in general is a really cool city too. We have a fantastic food selection between barbecue, Southern food, upscales, ethnic foods. There are so many choices.
There, but we have the next slide ready, and if anyone has questions, they can ask you later. Next is East Virginia Medical School or Children's Hospital of King's Daughter.
Hi, everyone. I'm Sanez Devlin. I'm the program director at Eastern Virginia Medical School Children's Hospital of the King's Daughters. I'm here tonight with one of our chief residents, Josh Golub, and one of our rising chiefs, Enola Stage. We are a freestanding children's hospital located in Norfolk, Virginia. We are a level 1 trauma center. We have 24 residents per class and 4 chief residents. I think a really amazing part of our program is, although we're a large tertiary center, we have very few fellows throughout our institution. So we only have fellows in our emergency department, and we have a child abuse fellowship. So all of our other inpatient units, our PICU and our level 4 NICU we don't have any fellows there. So our residents really get an amazing experience working directly with our attendings. They are first up for all procedures. They have a really appropriate level of autonomy and get to have really great patient ownership. The biggest feedback we get from our residents upon graduation is that they really feel ready as they move on to fellowship and general peds practice. And we typically have about half of our residents that pursue subspecialty fellowship and about half that pursue general pediatrics. We do have a primary care track, and we have a really robust global health track as well, which is really this year, some highlights. We just this year moved to an X+Y scheduling model, which we've gotten really phenomenal feedback from our residents. It's really given us an opportunity to kind of separate our residents' inpatient and outpatient experiences, which they are really enjoying. And we've created a more robust outpatient experience for them, along with a new primary care curriculum that we're teaching through kind of small group cohort didactics, which they really enjoy. We are building a brand new pediatric mental health facility that is on our campus. It is walking distance from the Children's Hospital. It's a 60-bed unit. So we are super excited about that. That will be opening in the spring. So our new interns will be arriving as it's opening up. That mental health facility has allowed us to really grow our mental health division. So we now have about 8 to 10 pediatric psychiatrists who are really helping us develop a lot of awesome experiences for our residents so that we can really bolster and make sure that all of our graduating residents feel really solid and have a good foundation in mental health, which we think is really important. Along with that, we have a lot of other great curricular unique features. We have a dedicated leadership training for all of our residents. That's a longitudinal curriculum, as well as a professional development curriculum to help with career guidance, and make sure that each one of our residents really gets the individualized support that they need. I would say, as far as location, I kind of call us a hidden gem. I think a lot of people aren't familiar with Norfolk, but we have an amazing food scene. Our interns this year told us that we really undersold it during recruitment. So make sure I mention it, that it's phenomenal. We have a lot of cultural, great kind of activities. We are very close to the beach, just like 20 minutes from Virginia Beach. So a lot of our residents on their off time are hanging out at the beach, having a great time. The weather is pretty nice most of the year, so you can really be outside, I'd say, a good 10 months of the year, and the weather is pretty temperate. Some of the initiatives that we're working on this year, with our diversity initiatives, we've created a resident DEI committee that has 4 pillars: mentorship, education, recruitment, and community outreach. So they have a lot of phenomenal initiatives that we are launching this year that we are really super excited about. And I think one of the great things about our program is our residents are just super engaged, motivated. They really are invested in helping us grow the program. We really enjoy their feedback, and often solicit it, and they really help us make great changes, moving, as we move the program forward. I think, when I think of residency, I think, it's a couple of years where you have a lot of growth, both personally and professionally. You're learning quite a bit, you're working hard. And I think it's really important to feel supported. And so we strive really hard, even though we have a large number of residents, to help each resident really have an individualized experience, and to make sure that they feel supported through their 3 years, that we help them identify their individual goals, and make sure that they have the level of support and resources that they need, whether it be educational resources, wellness, mental health. We really make sure to provide that for every resident, because everybody is different and what you need is different. And so we really work hard to individualize that.
Dr. Devlin, we're going to open up the Q&A for later, but our next program is Wake Forest School of Medicine, Brenner Children's Hospital. So yeah.
Hey everybody, my name is Thomas Russell. I'm the the program director here at Wake Forest. In addition, Kimberly Montez, my colleague and associate program director, is with us. She is a general pediatrician and is an incredible guru of all things advocacy. And then later you'll have an opportunity to meet a couple of our residents. So we're excited for you to have the opportunity to spend time with them. What I want to really start with before we start talking about our program is just to say congratulations. This is a really exciting time in your life. Much like med school, residency goes fast and furious. And so it's really important to make good decisions and feel like you're getting the resources and support so you can have a very successful career as a pediatrician. Just to highlight, and I'm going to try to be respectful of time because I know it's hard to do all this, but we are a medium-sized program. We have 14 categorical positions and 2 child neurology residents. We are very invested in the idea that we have been very successful with both people interested in bound for fellowship, as well as people bound to do general pediatrics. And we believe that our commitment to the foundational aspects of residency really allow our folks to be very successful. When it comes to our curriculum, Kimberly will have an opportunity a little bit later in the breakout to talk about our advocacy, but that's something we have been incredibly successful with both in our region as well as nationally. And it's something that I think has been said in this, has been said tonight, but I think is really the heart and soul of a good pediatrician, no matter what you do. We have a very diverse opportunity in terms of various types of didactics. We, like many programs, went to an academic half day a number of years ago. And in the interest of time, I won't get into all the details of the things we can offer, but we really try to be holistic and make sure that you're board ready, but also that you're ready to be a pediatrician, because it takes a lot of soft skills and communication skills and all sorts of other pursuits to do this and do it well. We too are very invested as part of our commitment to understanding how to individually support our residents, having individualized curriculum, which comes with active mentorship and opportunities for various things, including pursuing things like advocacy, but also other research endeavors. In the last couple of years, we have made a real aggressive pursuit in making sure that folks in our program are really have ample opportunity for research, and we've been really impressed with how things have gone. In terms of location, Winston-Salem is a wonderful community. I'm not from these parts. I grew up in the Mountain West of the United States and came here and have no ambitions of ever leaving. It's just a really lovely part of the world, not just because it's affordable, but it's also just a really fun place to be. We are really close to the mountains. I'm more drawn to the mountains, so maybe that's something I enjoy, but we're also very close to the Atlantic, and so a lot of opportunities for beach trips as well. I think when I think about our residency, and what I like most about our residency is that it really comes down to great people. And that really starts with really great faculty that are heavily invested in the pursuits of their career paths, but also our residents. I'm consistently impressed how they are interested and invest in the ideas of mentorship, because there's a lot of opportunities, about 1,000 ways to be a pediatrician. And we think that comes with good counsel and support and guidance. And in addition, we have the best residents, and everybody's going to say that, and it's true, because being a pediatrician is a really special opportunity. But I'm biased that I really think we have the best residents. They work hard, they care deeply, and they put the time and effort forward to be successful. And so it's really just a pleasure to really support them. When you're looking for a program, I think something you should look for and think about is, do people got your back, right? That means on good days, everybody's going to celebrate you. On days when you're struggling, they still got your back, and they're going to help you be successful. I don't know where we're at with time. I want to make sure I'm respectful of time.
Right on time, actually, Dr. Russell.
Okay, perfect. Anyway, thank you for your time, and I look forward to seeing you guys in a Q&A.
Yeah, definitely. So next we have our Lady of the Lake residency, pediatric residency program in Baton Rouge.
Hi, everyone. I'm Dr. Melissa Roy. I am the Pediatric Program Director for Our Lady of the Lakes Residency Program, and I'm joined by Dr. Kush Parikh, who is our Recruitment and Selections Director and one of our pediatric cardiologists. So it's hard to fit so much information into a short period of time, and I talk kind of fast, so I'm going to try to keep it slower. But basically, we are a medium-sized program. We have 12 residents per year. We have 2 chief residents that stay on in addition to our 36 residents. We started in 2010 and graduated our first class in 2013, which means we're almost a teenager as a program. We also are an independent academic medical center, which means we're not directly under the umbrella of a medical school, but we function just like an academic medical center. So we have about 12 other residency programs with us. So when you are on your rotations, you interact with all different residents. You're going to interact with family medicine residents. When you're in the Peds ED doing your PICU rotation, you're going to have some of the ED residents with you, psych, ENT, derm, etc. We also have 2 medical schools from New Orleans. That's just about an hour away. So Tulane and LSU School of Medicine that send their students to come do their 3rd-year clerkships with us. So we have about 25 students from each of those schools doing their 3rd-year Peds clerkships with us, as well as 4th-year students visiting from across the country, and about 40 to 50 4th years each year. So you really have a lot of opportunity for teaching and working in a multi-level team. It also means that we're able to support research, the same research endeavors, quality improvement endeavors, et cetera, that an academic medical center can support. So we're a little unique. We have 2 programs within our big residency family program. So when you go into ARIS, we actually have 2 different program IDs. One is for our categorical PEDS program, which takes 9 residents a year, and the other is for our primary care program, which takes 3 residents a year. Both are great options, and we understand people change their minds, so they're not binding. But it's just a great opportunity for someone who knows that they really their heart lies with primary care and that they'd like to have more primary care exposure from the beginning. And our website goes into a lot more details about how our primary care program is unique. But like I said, we function all as one big residency family. We are also very lucky to be in a freestanding children's hospital. So we moved into our children's hospital October 5th, 2019, which means it's still very pretty and shiny and very colorful. And it's just such a joyous place to work. We've been really blessed that our residency program now gets to have its own home. I think our residents definitely feel like they own the hospital. And it's just great because our medical office building is also attached to the hospital, which means when you are in the ED, when you are doing your subspecialty rotations, when you're on the PICU, in our NICU, inpatient floors, et cetera, it's all in one spot. So the vast majority of your rotations are kind of under one roof, which means you get to see your colleagues a lot. You get to have lunch together, attend all of the didactic sessions in person. So that's just been a great adventure for us over the last couple of years to get settled into our growing freestanding children's hospital. I'm going to pass it on.
Hey everybody, I'm Dr. Parikh. I'm a pediatric cardiologist, and I wanted to talk to you about some of the other things that stand out about our program. One of the things we really pride is our close-knit family feel and the relationships our residents have with the faculty. Since we do not have fellows, there's a lot of one-on-one time with the faculty, and our faculty is really committed towards mentoring and supporting our residents. We have faculty mentors assigned to every resident that meet with them at least a few times a year, go over all their progress, make sure they're on track. If there are any red flags, we try to correct them as early as we can. And we want every resident to succeed in their career goals. We also, because of no fellows, it's easy for residents to do procedures, work alongside faculty on research projects. And a program leadership really values each resident's voice, and we want to hear about their feedback. We want to do everything we can to keep building and improving our program. And so we encourage the residents to come back and tell us what else we can do better. Our institution is faith-based and promotes serving those most in need. So really getting into the community to serve and advocate for our children. We also have a pediatric research director. And so the director keeps emailing us about like upcoming conferences. They email the residents about if they have any posters to present and help them make these posters, help them get the IRBs done. We also have a global health director who works with the residents and helps them set up global health experiences. And so I know, like, ultimately, yes, this is a difficult decision for y'all to narrow down the list of programs to apply to. But we really encourage y'all to look at our program website, learn more about our individualized curriculum, our global health opportunities, our research, quality improvement endeavors, and all the other opportunities, that help you become a good doctor, an advocate, and a good leader.
Absolutely. Next, we have Arnold Palmer Hospital in Orlando, Florida. Let's take it away.
Thank you. My name is Gene Chen. I'm the program director for the University of Florida Pediatric Residency at Orlando Health, which is based at Arnold Palmer in downtown Orlando. So before I tell you about our program, I do want to let you all know that despite what you may be hearing on the national news about the state of Florida, there are people here that are trying to do the right thing. Our residency, our institution, and the other pediatric residencies in their institutions are really trying to fight the pandemic and advocate for vaccination and mask mandates and social distancing. Plenty of opportunities for advocacy here. So the next time you guys hear something about the state of Florida in the news, just think about us, and we're trying to do the right thing here. We have a university-affiliated, community-based pediatric residency. We are under the University of Florida umbrella. We have a very academic approach to our patient care. We practice evidence-based medicine and teach evidence-based medicine. Arnold Palmer is a really great place. It was built in the 80s, originally as a community serving organization, and it still has its roots there. We still primarily serve the patients of Central Florida. We're very proud of that. We take care of a large number of the underserved patients in the region. And in addition to that, we have a lot of referrals, mainly because we're a large institution now and we have so many pediatric subspecialists. But it's primarily a community-based institution. We've won a lot of awards. We've been ranked in US News 12 years in a row now. If you had to ask me what our strengths were as a program, I would list a number of things, but I think chief among them, number one is that we really do have a program that's based on patient volume and pathophysiology and diversity. This is a busy place, and if you are someone that learns by doing, learns by seeing patients, learns by being at the bedside, you'll thrive here. We have the only pediatric level 1 trauma center in Central Florida. Our ER is busy. We have the second largest labor and delivery hospital in the country. We have 40 babies born per day, not per week, per day at Wayne Palmer Hospital. And so our residents are very active in the nursery and the NICU. We have a busy inpatient floor, PICU, and the continuity and the continuity clinic and the acute clinic are also on campus. The other strength I think I would highlight is that we are a mid-sized program. We have 14 residents per year. We really do pride ourselves on our collegiality and our camaraderie. Many of the residents, many of the faculty say here that it feels like a family. And that's really the intent of the program, and that's the spirit we want to maintain. We do have some fellowships. The fellows work really well with the residents. We currently have 5 fellowships, 2 of which were developed in the last 3 years. So we're very proud of their growth as well. And in addition to that, we have medical students, and of course, as residents, you'll be responsible for their education as well. Our medical students come from FSU and UCF and other schools around the country. We have a number of initiatives going on. I think like many places, our focus has been diversity the past year, and we've been really promoting that. I think one major accomplishment we've had recently is we've been able to secure funding, which is really important for any initiative. And just recently, we've been able to offer scholarships for fourth-year medical students who are underrepresented in medicine to come and rotate with us. So we're very proud of that. As far as our graduates go, about 1/3 enter fellowships, 2/3 enter general pediatrics. This year, we have a little bit more that are going into fellowship. I'm interested to see if that'll be a trend. And then as far as Orlando, what can I say? Some of you have probably been here for vacation or visited for one reason or another. It is the theme park capital of the world. But in addition to that, there's a lot to do. The beaches, being outside, water sports, especially swimming and kayaking, things like that. I do think it's a great city to visit, but it's also a great city to live in. And it's just laid back and it's growing, and there's always something exciting going on here. My residents, Lauren and Martine, are here with me, and you all will meet them soon. They can tell you more about that. Our program manager, Lisa, is here as well. And we really thank you for listening to us, and we hope to see you during interview season. Thank you.
Thank you, Dr. Chen. And our final program is Memorial Health Pediatrics, or Children's Hospital of Savannah, and then we'll open the floor.
All right, well, good evening. I'm Dr. Allison Ebank. I'm the program director at Memorial Health and Children's Hospital of Savannah, and I've been the program director here since 2017. Our program started in 1996 as a community-based program, and we are now affiliated with Mercer School of Medicine that has a 4-year med school campus right next to our emergency room. So we are a community program affiliated with Mercer School of Medicine, Savannah. So one of the biggest news in our campus is that we opened our freestanding children's hospital, which opened in March 2021. So we have our about 150 bed children's hospital, and about 82 beds of that is NICU. We're the only children's hospital in Southeast Georgia. We're the level 1 trauma center. We are the only children's hospital between Jacksonville and then Augusta and MUSC. So we have about 100 county catchment area. So we see patients from rural communities who have really underserved access to healthcare. And then we have urban populations that are in Savannah. And then Savannah also, because of its proximity to Fort Stewart, also has a lot of refugee population. And so we see a lot of families, both from Africa and also most recently from Afghanistan. So we have a very strong emphasis on advocacy and social determinants of health. I like to say that our program is right-sized. So other than the NICU, there is no patient that's in the children's hospitals that's not touched by a resident. So our hospital service sees all the patients. There's no private pediatrician admitting service. And so every single patient on the inpatient floor, the PICU, ED is being seen by a resident team, including HEMONC and the subspecialty services. So the only place where the residency program is not enmeshed with our children's hospital is in the NICU, because we have 82 beds. And so we have one resident team there and then some other physician coverage. So we have a dedicated pediatric emergency room. We have 6 subboarded pediatric ER docs. We're the only pediatric emergency room in 100 counties. So some curriculum highlights: we do a full orientation month in July with inpatient and ambulatory experiences. We sort of have a modified X+Y schedule. So when you're in clinic for the month, you have continuity clinic the entire month. And then we have removed the clinic from HEMONC and PICU, but our residents still have some clinic during inpatient months. We have PICU rotation at the end of our intern year, and this feeds well with our being a regional referral center and a level 1 trauma center. We have a dedicated class-wide embedded community pediatric experience during the PGY 3 year. And we also have all of our residents impaneled in our continuity clinic. So the residents are the PCPs, and this has been a highlight with our residents and one of the favorite things that they have experienced so far this year. So we have several diversity initiatives. We're in the middle of a GME rollout of a GME-wide curriculum on healthcare disparities and health equity. And then we also have a lot of opportunities within the hospital and our institution to serve on DEI committees. So we are, again, I said, right-sized and well-matched with the size of our hospital. So we have 8 residents per year for a total of 24. However, we are part of Memorial Health Graduate Medical Education, which encompasses about 140 plus trainees across the hospital. So we have radiology, surgery, OBGYN, internal medicine, and family. And lastly, we are located in historic Savannah, Georgia. So I encourage everybody to go to visitsavannah.com. It's one of the more popular travel destinations on the East Coast. So we have a vibrant downtown, and then we are also 20 minutes from Tybee Island and with good access to the beach.
All right, actually, Dr. Allison, you finished 1 minute earlier, but we can kick off the Q&A portion. So our first question, I'll just throw that to you, Dr. Allison. How does your program support residents' research interests?
Okay. So we have faculty mentorship programs that are matched up. Our HEMONC subspecialty service has a lot of current QI and clinical research initiatives. We had residents do published case reports in the past, and we've also had them present at PAS in the past. We have a lot of pathology, and so I would say most of our research is either case series or case reports and quality improvement.
Awesome, thank you. This one is for Dr. Chen. Sorry. How does the University of Florida affiliation help the program from a networking, away elective rotation opportunities, or any other way?
That's a great question. So that's a very common question we get during interview day also. The UF affiliation, there are 3 programs under the UF umbrella. It's Gainesville and Pensacola and us. We share a lot of resources. We do joint conferences. The residents who are more interested in fellowship will often do rotations at the other sites. For example, we have a resident who's interested in NICU, and she did her required NICU rotations with us, but just wanted to get exposure to a different unit in another area. So she's going to do a NICU rotation in Gainesville as well. So there are a lot of opportunities to collaborate, and we're very flexible. If residents do want to rotate at other sites, we do cover expenses for them, and we really try to work together with the other sites and work with our residents.
Okay, thank you. This question goes for for University of Tennessee. How does your program help those joining with the transition from fourth year medical school to beginning as an intern? University of Tennessee.
Hey, I'll answer. So as soon as interns match, everyone is added to our weekly email as soon as they get a UTHSC email so that they can kind of help understand or better understand the flow of things. We also make sure to reach out to all of the interns regarding places to live in Memphis and other things to know about the city. So that includes places to eat, places to establish primary care physicians, dental clinics, eye clinics, you name it. We pair each intern with a second or third year that's termed intern buddy, based generally on your clinical interests, and many of those pairs meet before residency even starts to kind of help mentor them along the way. And those people also become lifelong friends. And then this is all in addition to the orientation that you get both at UTHSC with graduate medical education and the UTHSC PEDS program.
Okay, thank you. I'm going to open the floor for other program leadership to answer. Any advice for the upcoming virtual interview season?
This is a free-for-all answer?
Yeah, it's a free throw.
Okay, so first, I would encourage students not to eat or drink while they're being interviewed. That's the main thing that's going to be really distracting. So I think all of us have done FaceTime and Zoom and WebEx and whatever for a long time. And so, you know, nobody's going to be upset if you forgot to unmute or anything like that. But I would refrain from eating and drinking, and also make sure that you have good lighting.
Just add to that and say, you know, I think I would say just be yourself. Don't be nervous. If connections mess up, we understand. I think we are all going through this. There's so many times I forget to unmute. We've all done this. I think all the APDs, PDs, and chiefs on this we understand more than you think. And your personality, just let it shine. It's okay. And if you have a favorite hobby or something, if you like painting, if you want to hold a picture of that and show us, keep it handy. Something personal, you know, is always welcome too. So I think just show a piece of yourself and be real is what I would say. And don't worry too much. If technology fails you, we can reconnect.
This is Thomas Russell at Wake Forest. The good news is that we've done this before. Last year was an experiment for all of us. There was a lot of apprehension for both, obviously, the applicants, but also for residency programs. But I will say, at least for our program, and I bet this is true for most programs, we were able to really identify people that really spoke to us and really were committed to the same things we were committed to and really interested in the pursuit of pediatrics. And that translated to us meeting people for the first time in kind of late June and into July. And we have been so impressed with the folks that we were able to have come to our campus. So much like that's already said, try to enjoy the process. It's a stressful process, but it's a meaningful and purposeful process, and good things will happen. So good luck.
So we have time for one final question. It's going to be a free throw as well. If you were an applicant, what would you be most excited about at your program? About you, Dr. Russell.
What I'm most excited about, I just think residency is fun. It's a really exciting time. So having an open mindset and finding like-minded people that have equal pursuits. I think you're not going to make a mistake by going into pediatrics. So check mark, good for everybody. But realize that there's a lot of good reasons to be in the Southeast. There's a lot of good reasons to be in small programs and big programs. So really think long and hard about what your needs are, and don't be confused by maybe other medical students or other people that have strong opinions. Just really think about what you value and your pursuits. And I assure you that that kind of thinking will lead to good things.
Hey, this is Dr. Parikh with Our Lady of the Lake. And right, like Dr. Russell said, this is a great time. This is your time to learn. You are here for 3 years. And this is like a wonderful, wonderful time where you get to, learn so much about pediatrics without the fear of having everything on your shoulder. You always have an attending on your back. And so take this opportunity to understand what you want out of the residency, where you want your career to be headed, and just explore during this time. And so that's one of my favorite things about residency is you get to and at the lake we let y'all kind of tailor your tell the residency according to your career plan. So if you want to do more gen peds, we'll let you do more gen peds. If you want to move into fellowship, then we'll plug you in the right people for fellowship. But just take this time to explore, to learn all you can about pediatrics.
I just wanted to interrupt quickly and say, just in case we get sucked back into the main room, that if you didn't read the chat and you're from a program and you have some sort of virtual open house or like a meet and greet with residents or something where we can get to know the programs more, let future Peds Res know whether you want to email their Gmail. I posted it in the chat, or you can just tag us like on Instagram or anything like that, because they have a calendar where they're putting everything. So it's really great for applicants to be able to see what's going on every day, because it's hard to keep track of with everything that we can attend and things like that. So those are great opportunities for us to learn more. And if you're going to have any, we'd love to know about it.
All right, thank you all for attending today. Thank you to the program leadership. Thank you to applicants. And don't forget to fill out our survey and follow us on Twitter and Instagram. And thank you for attending today. Now we have a happy hour with the residents. So if you'd like to follow through to the main